Welcome back to Good Morning Maine. I'm here with Dr. Vanessa Little of Northern Light Health, and she's here today to talk about a very important subject to her and for everybody, palliative care. Dr. Little, thank you so much for joining us.
Thank you for inviting me.
So why do you work in the palliative care field?
So I trained in family medicine and realized in the ICU that palliative care was really where I wanted to go, because palliative care allows us to tell the truth and let patients and families know they have choices. I work for Northern Light because I feel passionate about all Mainers having equal access to palliative care, and it felt like Northern Light was the right place to make that happen.
Cool. Yeah, and it seems like you've been able to. What is, for the folks who don't know, what is palliative care?
Palliative care is a specialty in medicine where we help people with serious illness live their best lives. It's for anyone living with serious illness that wants to have a say in their care.
Gotcha. So, excuse me, is this different than, it's obviously different than hospice care.
It is,
Yeah.
and we get that question a lot. And
Yeah.
interestingly, I look forward to the day that we don't hear that question anymore.
Yeah.
About 50 years ago, hospice and palliative care were the same thing.
Yep.
But now in this country, hospice is both a philosophy of care and a healthcare delivery model for people that have life-limiting illness, who either there's no further curative treatment available to them or they don't want to pursue more curative treatment. Hospice care is the best care to help them be at home. Whereas palliative care is, like I said, a specialty in medicine. It's for anyone living with serious illness at any time in the course of their illness.
Gotcha.
And it's just an extra layer of support. It doesn't replace anything, take anything away.
Gotcha. So can you give me an example of what type of support that may be for a certain type of person?
Sure. When we first meet someone, I always ask, like, what do you know about palliative care? And most of the time they're just like you, like, we don't know.
Right.
So and I think part of that is because it's so individually focused. It's whatever that patient needs. So sometimes it's talking about goals of care and what would you most like your care to look like. Sometimes it might be symptom management, like pain or shortness of breath or nausea. And also in palliative care, we think of the whole family as a unit of care. So we also support families and patients. A lot of it is coping.
Yeah.
Unfortunately, financial stress is common in serious illness, and we'll talk about that too.
Oh, totally. Yeah, chronic illness and financial stress, big connection there. Yeah, and I mean, I think any therapist would say too, poverty is a big indicator of mental health challenges.
Yes, of course.
Yeah, because naturally. But that's fascinating. So how does this how is it different than maybe consulting with your general care practitioner?
So palliative care physicians are specialists. We have a separate board certification and fellowship training. So our procedures are conversations, and it's about building rapport. We are experts in how to have those conversations and also in symptom management. There are plenty of primary care providers that can provide basic palliative care too. Not everyone needs that specialty level of service. And sometimes it depends on the individual. Some primary care providers or specialists are more or less comfortable with symptom management and also with conversations about goals. So
totally. Yep, it takes a different, different people with different specialties. Okay, so if somebody thinks that this is something that they should look into, how can they learn more and look into it?
Yep. Well, it's a good place to start would be with your primary care provider, other specialists. They can make a referral. Yep. But you could also just call us at Northern Light Health, 400-8741, and we can help guide you, answer any questions.
Yeah, it seems like you guys have an advancing program on palliative care.
We do.
Very cool.
We have clinics in Brewer, Blue Hill, and Ellsworth are coming, Presque Isle, Pittsfield, and Portland, and we offer telehealth in places that we don't have in-person care.
Oh, fantastic. Yeah, telehealth has really helped me out in times of need.
Great.
Cool. Well, Dr. Little, thanks so much for telling us about this.
Thank you for including me.
Of course. We'll send it over to Devin Biggs with our full weather forecast.